Today, a battle to save the life of a stabbing victim.
He's arrested, so can we have thoracostomy on arrival, please?
John treats a woman in unbearable pain.
Shouldn't take 3 years, should it? To be pain-free.
And a toddler needs help after a seizure.
So sometimes people do fit again, so don't be worried.
We're primarily tasked to major trauma jobs, cardiac arrests, that sort of thing, mainly because we are more experienced and more used to dealing with patients who are seriously unwell and critically injured.
Yeah, we had reports of a in the city centre. There's been no message to say that the attacker has left scene. In fact, there might have been one of the callers who said that the attacker is still on scene, so it's normally sensible to not wander into the middle of the scene when the person who's been in is still around.
Currently, we're the only response. There's also no police in attendance as yet, waiting for the update there. So we've now got a land ambulance going, so we're no longer the only response.
Just arrested, Ryan.
Okay, get on the chest then. On the chest.
As far as we can see, a single wound to the left side of the chest.
Out here.
As far as we can see,
Okay,
single
keep
wound
going,
to the
Mel,
left
keep
side of
going.
the chest. Can't see any of the wound.
When we got there was concern as to whether or not his heart was still beating. And the thought was that actually his heart may have stopped already.
Okay, get the top then. Get the top then.
Got it. Yeah.
We took him off the back of the truck, and as I started to examine him, I thought I could feel a very weak pulse in his neck. So I thought that maybe his heart was still beating, and that just changes the nature a little bit of the interventions that we look to provide for that patient.
Okay, what have we got?
A single wound to the left side, on arrival, no radial pulses. Okay, he has got a central. Jesus was 4.
Okay, guys, I want our airway kits. We're just going to get a tube in him.
Yeah, it's pop tube down.
So if you just open up his airway, mate, see if you can get as much as you can in. Okay, so, Rob, we just think we've got one isolated wound to where, sorry?
The left side of the chest.
Okay, nowhere else.
That's the only one we felt. We've checked his back, we've checked his legs,
We've got
his neck. Can't find anything
that
else.
side's rising nicely. We've got equal rise and fall. Can you just try and open his wound? Eyes for me. Okay, and this side again. Okay, equal and reactive, about size 4.
He's not arrested yet, but he's going to arrest soon.
Yes. Currently, we're going to load and go. We're going to give them some TXA en route. If we can activate the major hemorrhage protocol, please. And we'll update you as to any other injuries when we check en route. If we can get cardiothoracics waiting for us in A&E, that'd be awesome. Receive.
Right, let's have a quick check. So we passed on an alert message to the hospital to allow them to get ready to receive the patient. He was going to need blood on arrival, and he was going to need surgery on arrival.
Happy?
And it's trying to communicate that need so that there's no delays in his care when he gets to hospital.
On slide. Everyone happy? Yeah. Ready, set, slide, and stop there. Chris, coming in, just put that seat up. Eyes are 1, verbal 2, motor 1. So cardiovascular hasn't really changed.
It doesn't fit with a single stab wound. I mean,
Can you just check on that right? We see we've got a radial, because I've got one on the left. It's weak, but we've got it.
Are we all good? Yeah.
The team can feel a weak pulse.
I did have one that's disappeared. This one just here, look.
Yeah, look, there you go. Just here.
On the way to hospital, the situation changes dramatically.
Have a listen if you can. I know it's going to be tricky.
It's good rise and fall on both sides.
The man's heart appears to have stopped.
Certainly not barreled, is it? And normo-resonant by the sounds of that.
Stick it. It's going to stick out, yeah. Holding that chest anyway, see what happens. We're quite close to getting to
In order to try and relieve the pressure, I got a scalpel, I made some holes, and I essentially let the blood out of his chest.
Then we're in the right place.
and we got quite a significant amount of blood out of one side, and actually that change in pressure enabled his heart to start beating again.
OK, let's get that fluid attached.
He's arrested, so can we have thoracotomy on arrival, please?
He had such serious injuries that he was going to need surgery within the next 5 minutes.
OK, one blade.
Chaps, don't worry about the chest.
We're all complex, aren't we?
Long up on this side.
Are you coming on this side? There you go.
Guys, don't worry about the chest, because it's not dropping yet, is it?
It's about recognising that and giving him the care that he needs as quickly as you can do in the back of a moving ambulance. Otherwise, he's got no chance of surviving.
We're increasing our output again.
We're coming in.
So that's worked, mate, that has. So whatever's on this side, I think
It's just tamping up.
we've done the job, yeah. So we're back up again.
Gently venting.
ETA, please.
90, 30 seconds, we're
We're in there, wonderful. As soon as we get there, let's make sure all that cable's up and ready.
Just about that scalpel's gone.
Yeah, it's in there now, mate. Yeah, it's all good. Thank you.
12 minutes later, the crew arrive at Queen Elizabeth Hospital.
Nice and slow, nice and slow. OK, good.
Do you want to get him undone?
Critical. That's how serious this incident is. So he's obviously experienced a single wound into his heart, so it doesn't get really much more serious than that. Luckily for the patient, he's been brought to a major trauma centre, and very quickly on arrival here, he was sent straight up to theatres. So he's currently in theatre with cardiothoracics, opening his chest and hopefully sealing the hole that's been caused by this assault, or alleged assault.
I have been in the ambulance service for 16 years now. I've been a paramedic for just nearly 10. The worst thing about being a paramedic, it's the strain within the service. The amount of jobs that we do, they're escalating, they're getting bigger and bigger by the day. The best thing is the ultimate, it's saving someone's life. Being there and the actions that you do actually save someone's life. I don't think there's any other feeling that you can have. In 16 years, it's done me fine, fingers crossed.
Currently on our way to a lady who's suffering with severe abdominal pain. So he's going into a back and into a groin. Could be a multitude of different things really, anything from kidney stones to a water infection. See what the history is before we get there and see if we can help her out. So what's been going on again, remind me? I've slept since.
Keep getting this pain in my stomach.
Yeah.
My groin, my leg.
Okay.
Keep having flare-ups. I was great. I've been down the park with the kids. I've done nothing strenuous, have I? It's just come on with a vengeance.
It started off 3 years ago, and had this really intense pain. I thought it was appendicitis, and so did the doctors when I got to the hospital, but it wasn't. They did every test imaginable. I mean, I was in there for 4 days, and they couldn't find out what it was. And after that, it seemed to be every week I was calling an ambulance for this pain. Excruciating, can't explain how bad it was.
How have I been agony?
I've had 3 children, and I would rather give birth 5 times than go through that pain.
And it comes in spasms. Oh. It's me back.
Right.
So I've lost 2 discs in my back.
Right.
And my bones are crumbling. And it's dust. It's in the nerves.
Okay, it's all right.
Wendy's condition is chronic. All John can do is offer her different levels of pain relief.
When's the last time you had some paracetamol?
About 2:15 on its own.
Try that then. Right.
And I can't have that in here because that makes me sick.
Right. Get a cannula into her hand, give her some morphine, and we'll pop up to us as well. This lady, she's known to me. No, she sounds like a long-standing history of disc problems, pain going down to her arm. She's waiting to see the pain clinic, basically long-term chronic pain relief. But it's obviously flared up today. She's done a bit of out and about, haven't you? So you've been down to the park, so... What was nearly in? Let's have your hand, sweetheart.
Yeah, I'm going to wait till this goes. Oh. Sorry.
That's right.
Oh, and I hate these pigeons.
You do get used to seeing people in pain. That's definitely part of the job. It's worse to deal with when you can't do anything about it. We've got quite significant painkillers we can give intravenously, but when you've given all that you can give and they're still in pain, it's quite hard to deal with, and you kind of, it's just all you can offer them is sympathy, really.
This is John's third visit to Wendy in the past 12 months.
Oh, can I have some water?
Push get some water, chick.
I got some.
Use some grapes as well if you want.
See, I got some.
You're a fan as well.
I could do without it, I tell you.
So when you've got somebody like John who's really friendly, it does put you at ease. I think I've seen him in the daytime, middle of the afternoon, and I've also seen him like 3, 4 o'clock in the morning, and he never seems down. He's always upbeat, always happy and smiling, you know. He's probably dead on his feet, but he still puts you at ease and does his job so professionally. He's just a nice bloke.
Shouldn't take 3 years, should it? To be paying for him.
The problem is we don't really know what's causing it, do we? No. If you don't know, it's...
When you don't know what's wrong with you, but you're in constant pain, you do get angry and frustrated. Think, you know, what the hell is going on? Am I going to die? And you do think they're a lot. I've had very dark days, and I have cried and cried. And it's an awful thing to say to your children, but I've even said to my children, if this is the rest of my life, I don't want it.
How are you feeling now?
A bit better.
Anything kicking in? Anything make you feel funny?
Sorry?
Anything making you feel funny?
No, I'm all right, I'm just itching. Just my arm's itching.
And that's normal for you?
Yeah. It's crazy, it's instant. As soon as the morphine goes in, my arm itches. Oh, it's ever such a funny sensation, that is.
That is.
Oh, you can feel it all up here.
It's a good job I hit the right one then.
18 minutes after being given the morphine, Wendy is on her way to hospital, where she will receive even stronger painkillers.
The hardest thing about being a paramedic is the suffering that you deal with. You've given everything that you can, and if it's still not working, well then, it's get them in somewhere where you can give them something better.
I recently changed doctors, and she was marvellous and got me to see different specialists, and things started to really move then. And I had an MRI scan, and I finally had a diagnosis. After 3 years, it was amazing. I've been diagnosed with disc degeneration. After the diagnosis, I went in for a procedure, which I hope has worked. I had injections in my back into my nerve endings, and I've only had the pain once since. So we might be getting there now. It feels absolutely amazing. It really does. I feel like I've got a life again, because my life was put on hold for 3 years. In those days, I just felt that life wasn't worth living. Most of the time, I was just sat in the armchair all day watching telly, and it was so depressing, it was so lonely, and I've got it back. I am so grateful to every paramedic I have seen. They are worth their weight in gold. They really are. If I could give them a medal, I would.
Well, it'd be interesting if this is a job with Carl's. BASIC stands for the British Association of Immediate Care Specialists.
No, as soon as I put down a bus.
Roger, many thanks out. It's purely charitable what we do. It's all in our own time, just aiming to bring the skills that we've learnt and use every day in the hospital and taking those out to work alongside paramedics and just assist them in these more complicated injuries. One thing that's hard to train is teamwork, team leadership, communicating with your patients. You can know everything in the world about medicine, but if you don't know how to deal with patients, don't know how to deal with the scene, you'll never get anywhere.
OK, so we're going to a 2-year-old girl who's been found by mum fitting. The most common cause of fitting in young children is having a high temperature or being diagnosed with epilepsy.
So the problem is with children, if they have prolonged fits, you can end up getting significant brain injury.
Yeah, this is quite a tough job to start with, especially for my first shift on here. So I'm going to be watching how Ben interacts and what Ben does, because it's certainly something that the textbooks don't tell you.
How do we get into you around here? Okay.
In the worst-case scenario, a fit can be life-threatening. Ben needs to quickly assess the toddler.
Okay, hello there. How are we doing? Has this young one been diagnosed with fits before?
She's had a fit before because of an high temperature.
Okay.
But she hasn't been diagnosed with epilepsy or anything like that.
Okay. Let's have a quick... Ashanti's temperature was way above 39 degrees, so she was very, very hot, so much too hot for a baby, and that's almost certainly why she fitted. So what was she doing earlier?
She was lying on the settee with me and then next to me, so I just noticed that she was fitting.
Okay, fine. And when you say fitting, what do you mean by fitting?
Foaming from the mouth.
Okay, okay. Shaking, and she stopped shaking since then. How long did the shaking last?
I'd say about 10 minutes.
Hello there, sweetie. Aren't I horrible? Let's pop your finger in there. So sometimes people do fit again, okay? So don't be worried. She's got the right people here now, and we've got an ambulance on the way, and we will be going in, okay? It's a real pressure dealing with children, and the smaller they are, the more pressure you feel. Well done, thank you very much. So this is just a little bit of oxygen because her oxygenation isn't perfect. It's nothing that I would be worried about, but I can... Oh, look at that. There's two reasons why we routinely give oxygen to children that are fitting. One of the causes of a fit could be not enough oxygen in the brain, so we give it for that reason. The other reason is we want to make sure there's plenty of oxygen getting to the brain because there's increased brain activity during a fit. So we want to avoid this second damage to Ashanti.
So I've never seen a child have a fit.
Oh dear, it's not nice, is it? Especially not when you're mum. All right, sweetie. Hello there. Let's just leave you where you are. Well done.
The ambulance team arrive, and Ben updates them on Ashanti's condition.
She's coming round a bit. She's eye-opening. We'll just see what the BM is. Do you mind taking over the head end and just making sure she's maintaining her own airway? The respiratory rate's 24. And GCS is picking up as we go along. She's just eye-open spontaneously. I'll just have a quick word with your crewmate, and I'll give him a hand getting everything prepared so we can get her into hospital.
Smashing.
Concerned Ashanti may have another fit in the ambulance, the crew need to be ready to deal with it.
We want to have intravenous access so we can give the necessary drugs in order to stop any further fitting. But hopefully, if we can get her temperature down, we can reduce the risk of that. OK. Then if you want to... The head end is at the far end, so if you want to lay her down here, that's great. And if you want to sit next to her... OK, well done.
Ashanti's dad, Rich, has rushed home to be with her.
What you been doing? Are you? What's happened again, then? It's all right.
Sometimes they get a bit confused after a fit, so she might not be recognising you particularly much, but that's just because she's had a fit, OK? Nothing to worry about.
Are you? What's happened again, then?
Now, I'm going to try and put a little plastic needle in her hand. So if you want to concentrate on leaning over that side so she can see you over there. OK.
Over here, babe.
Well done, well done.
Well done.
Okay.
It's all right.
I need to pop a cannula in. If she is going to fit again, I need to be able to give her drugs. And the only way we can reliably give drugs is by giving them into a vein. So if we can easily get access, we'll get it. OK, so a horrible scratch coming up for her, so...
It's all right, Daddy.
Nasty scratch.
Come on, kid. It's all right.
Yeah, it's a bit of a high temperature and a bit of a high sugar. So what we're doing, we're just running it in just to make sure that everything's OK, because there could be 101 things, especially with children. They could do really well and then crash really easily, but it don't seem the case. So it's just all playing it safe for the moment.
OK, we're very good. Luke, sensible pace, OK?
Dr. Clark's going to go with just give the crew a hand, really, but apart from that, just a straight drive in.
What's our ETA?
It's okay.
Oh, dear. 8 minutes, brilliant. Can I speak to one of your colleagues, please? And she has a temperature, initial temperature of 40, which has come down to 37.8 now. She hasn't fitted since, and her level of consciousness has improved since then, so she's now eye-opening spontaneously, a little bit confused, not particularly attentive to mum, but I think she's probably someone who'd benefit from either coming to resus or the children's area, just to be kept an eye on, maybe some intravenous paracetamol, you know, etc., etc. Our ETA is 6 minutes from now. OK.
Oh, yeah, it's really scary.
So, Mum, can you tell me what happened today?
It's fine. I think I'm still in shock. It's normally Dad's there, so I'm running around like I have this chicken screaming, but I didn't have time this time. Oh, yeah, it's really scary. I feel hopeless.
Don't be crying when we go in, otherwise they'll think I've been horrible to you. Mum was really quite distressed by this, but she did an absolutely excellent job. Yeah, go on, follow alongside, hold her hand if you want to. Can't reiterate to her what a great job she did.
At Royal Stoke University Hospital, a shanty is taken into the children's area.
Hello, hello, hello.
Hello.
How are you doing?
Oh, yeah.
This is young Shanti. She's 2 years old. She's had one previous episode of a febrile convulsion. Oh, dear. Don't like it when they cry. Hopefully she won't fit again, but if she does, she's in the right place. They've got better lighting, they've got full equipment, they've got more pairs of hands. So if she fitted again, we'd be in the right place, pop some IV access in and give her any appropriate drugs. OK, right, take care.
Thank you.
All right, bye-bye.
Today she was just lying down on the sofa behind her mum's legs, and mum felt a couple of kicks, thought she was playing, and she turned around, saw her and saw that she was having a convulsion. And then got on my phone to me and I had to get back sharpish, type of thing. So scary, very scary. You know, I'll have a little cry about it later, off camera, of course. I will. But you know, you have to try and stay calm. As a mother, you're going to panic, but you know, she's done well. Mum has today. She's done really well.
I think the profession paramedic is all about helping people, being available in your community, particularly where I work in Stourbridge. It's sort of where I grew up, so it's nice to give something back to the community that I've always been a part of. We're on the way to a male patient. He's 28 years of age. He's in a public place. The job's come through that he's having chest pain and palpitations. Quite limited information at this time. In certain cases, you don't want to be outside, particularly sort of patients sort of like with a reduced level of consciousness. Things can quickly change and they can become quite unwell if they get cold.
The man was driving when he felt chest pains, so pulled into a car park and asked a passerby for help.
I was driving down the road and he just flagged me down. Asked if he could call an ambulance for him.
Hello there, mate. Oh, is it Dave?
Yes.
All right, mate. OK, hello, mate. I'll tell you what, do you want to come and have a seat just on the back of the car and we'll have a chat? All right. Hey, so what's been happening?
I've started getting these flutters in my chest and my heart.
Right.
And it keeps making me want to go cough.
OK.
Expel my air. And I can feel it, like, speeding up and then thumping. And it's making me feel like it's going to stop. And I can't stop, like, keep coughing like that.
So the pain you had, how would you describe it to me?
It's quite sharp.
Sharp pain?
Yeah,
All right. Is that past now?
Yeah, it has, but my heart just keeps, like, doesn't feel right.
All right. Right, then what I want to do, with the symptoms that you've explained, an ECG is obviously the foremost thing. We'll have a look at your heart.
OK.
All right, we'll have a look at the heart rhythm and see what's going on. Is that OK?
Yeah. I knew something was pretty serious at that moment, and I needed to get help as soon as possible.
Pop your finger in there, mate.
I was very worried with my two children in the car for their safety as well, because I was driving the vehicle at the time. If I were to have passed out or anything and the car was moving, I could have caused a lot of injury to myself and my children, let alone to the public.
Okay. Do you suffer with anxiety?
I have had anxiety, yes, but I've never had it on this scale, never.
Does this feel like anxiety but worse?
Yeah. It just, my heart just doesn't feel right.
Okay. Dave's complaining of symptoms suggestive of sort of like palpitations, so potentially a cardiac problem. There's 4 sticky dots, 1 on each ankle and 1 on each wrist, and then the 6 sticky ones on your chest as well. Yeah. So we can do an ECG, have a look at the electrical activity in his heart, see if everything's where it should be, and we'll take it from there. See you shaking there, mate. Yeah. You cold?
No, not really, no, just a bit shaky.
Initially, having a feel of his wrist, his pulse does feel fast, not excessively fast, but faster than sort of what we'd expect as normal. Just let this settle down a moment. He said he suffers with anxiety, he has done in the past, so it may be something along the lines of that, but we'll have a further sort of investigation and we'll see what's going on. Your ECG's okay. All right, there's nothing abnormal on there, apart from it's ever so slightly fast. What sort of pain did you have yesterday?
It was when I was lying down in bed. I was getting a bit of sharp chest pain that was sort of radiating around the centre of my chest.
Yeah. I'm thinking, after looking at his ECG looks okay. Everything's where it should be on the tracing. So I think I'm going to go down the route sort of like an anxiety type thing. What Davies explained to me with his symptoms yesterday is suggestive of anxiety. In fact, it was a sharp pain, which came and went of its own accord. Cardiac pain, we wouldn't expect it to pass on its own. Somebody'd have to intervene and do something for him. So, you know, everything's looking okay for him at the moment, but I think there's an element of anxiety with him, so we'll try and calm him down and put his mind at rest. Oh, your chest sounds are nice and clear. Now, your heart rate's reduced a little bit. Yeah. It's not quite as fast as it was. Yeah. All right, and say your ECG's fine. I don't think, with everything we've checked and what we've found or not found in this case, I don't think there's any reason for you to go to the hospital.
OK.
All right, peace of mind for you?
Yeah, it is, thank you.
OK.
Steve, the paramedic, he was very calm, relaxed. He knows what he's doing. That, to me, picking up those vibes, you know, was kind of telling me that he wasn't too concerned.
I think in everyday life, in a modern-day society, then stresses and strains of home life, work life, social life become sort of greater. I'd say that anxiety is on the up, really. I mean, we can associate fast heart rate and palpitations with anxiety symptoms. Mm-hmm. You know, they're one of the observations that we tend to see with anxiety.
OK.
All right. OK, you do seem quite anxious as well.
Yeah, I am a little bit, just worried. And I had my 2 boys in the car and obviously I was...
Are they still there now?
Yeah, they are. They're eating their food at the moment.
Do your boys know what's happening?
I'll explain to them later. I think they think it's pretty cool because obviously kids and ambulances and firefighters and I feel a lot better now. And obviously the gentleman said anxiety and that, so I'm going to go to the GP and talk to him really and see what they can do for me. And that, because I've never had that sort of episode before happen. I think when I get back, I think I'm going to sit down and have myself a cuppa and watch a bit of TV and just relax. I think that's what I need to do now.
Right.
I'm going to drive back.
Do you want me to follow you back, or...?
I'll be okay,
You sure?
Yeah.
As well as calling 999, Good Samaritan Anthony has been keeping an eye on the kids.
You can tell when someone's not feeling good, and he didn't look so well, so you're not going to keep driving, are you? You're going to stop and help somebody out, really. It's what you have to do.
And I've got a load of them all up here as well.
Touch wood, everything's all right. They're giving them the all clear, so good news at the end of the day.
Anybody with a chest tightness and palpitations, they do need to get it checked out. You know, anxiety isn't the only cause for them. You know, you can obviously have an underlying heart condition. So if those symptoms do occur, then it's always important to get an ECG done, you know, or see your GP or you know, the ambulance service. So, you know, the guy's done the right thing in sort of like getting checked over, you know, to rule out anything more serious. But, yeah, we're quite happy that he's sort of like, he's OK.
And I started to listen with my chest. And that is when they picked up on something that was abnormal with my heart rate. And that's when they told me that, you know, it was a diastolic murmur. From what I believe, diastolic murmur can be a result of your valves in your heart being faulty. Basically, I've got to go and see a cardiologist. Currently, at the moment, I'm wearing a heart monitor. Steve, that night, when he advised me to go to my GP, it's almost like a bit of a blessing in disguise, maybe, that happened, and, you know, kind of, it was fate for this to happen and for him to be there, because otherwise I may have not ever found out.
Right, so you're walking okay, but you're still feeling wobbly?
Oh, very.
Let's come back here. I get called out to a lot of elderly people on their own, ranging from just a general safe and well check, right to the other end of the spectrum.
Chest nice and clear. What I want to do now is shine a light in your eyes, OK?
We get called to a lot of falls with elderly as well, and again, you just have to treat them with tender, loving care. We've got an elderly gentleman who's fallen on the floor. Don't know if it's a mechanical fall or he's had some sort of faint, we don't know yet. He's unable to get up off the floor, and it is reported that he's got some sort of back injury.
She's only a few miles away, but the traffic is causing problems for Kath and an ambulance on a different job.
See, it's difficult at traffic lights when they're on red, because you don't want to push cars over into the path of an oncoming car. But now they're green, the cars still remain where they are. Instead of just going to let us through, they stop and you have to weave through them. But people do panic when they hear blue lights and sirens behind them. What is that? 253. Are you sure?
At the man's house, Kath is met by his daughter.
He's been on the floor about 3/4 an hour now.
Pardon?
He's been on the floor for about...
Right, do we know how he's fallen?
He's fallen.
Right.
He keeps going tired and falling asleep. He said he thinks he's sat down on the bench and falling asleep and falling off.
All right, so he hasn't probably fallen from standing height. OK. Has he complained of any pain anywhere?
He's in constant pain. He's on morphine and everything.
Right, so pain's not unusual for him.
No.
Where are we? Oh, we're here. Hello, my darling. What are you doing down there? Hey?
You told me.
Malcolm was actually on the floor. He had a fall, no initial injuries, but again, he just could not get himself up off the floor. Can you move this leg at all?
Yes.
Yeah? Can you bend it at all? Good. Is that hurting there?
No, it's just there, that's all it is.
And you've got no pain at the bottom of your back?
No.
Nothing going up your back at all?
No, not at all, no.
Unable to lift Malcolm on her own, Kath radios for assistance.
I'm going to ask for an amber response because the patient is outside in the garden and he is quite cold. So amber response, and we're going to need a crew with a manga help, please. When we have elderly people on the floor, we have to look at ways of getting them upright safely. Long gone are the days where we get behind them and just physically lift them up. It causes injury to ourselves and can cause injury to the patient. All the ambulances now carry a piece of equipment called a manga elk. It's a big lifting cushion, and it's the only way now to safely lift somebody up off the floor. Yeah. We're not going to know, you know. So he's got no pain in his neck or down his back at all.
I normally go out at night about 5:30 to water the garden, and I sat on the seat on the patio, and I've got this condition where I just fall asleep. Fell off the seat. Well, I took the seat with me under the table and knocked the table on top of me and all the plants. Couldn't get up at all. I couldn't turn over. And I panicked then because I thought, well... And then I remembered I got the house phone in my pocket.
He's been on the floor possibly 3/4 of an hour because these young ladies weren't in the house at the time. They've come and found him. Have you done all these flowers?
Yes.
How fabulous is that? It's beautiful. Did you used to be a butcher?
Yes.
You look like a butcher.
Very much.
You know why?
Why?
I've just seen your bike over
Oh,
there.
yeah.
Yeah, I thought so. Hiya, folks.
Hello,
All
hi.
right. Right, before we do anything, just look at this wonderful view. It is, it is. We're going to try and get this cushion underneath your bottom.
Yes, okay.
Okay? And then once it's underneath your bottom, we're going to roll you onto your back, so you're onto it.
Yes.
Then we're going to try and sit you up.
Okay.
Okay?
Okay.
Right. If you can just try and roll nice and steady, and we'll move the cushions with you. Keep going. Go on. You're safe. You're safe. You're safe.
Okay.
Right. Okay. Vanessa can just have a look. It's a big lifting cushion. It's in 4 sections and each one blows up individually. Nice and steady. So we go up probably 3 or 4 inches the first one, then the second, then the third, then the fourth.
Should we go up a bit?
Just go slightly up. And it ends up with this patient safely up off the floor in a sitting position. You're better sitting up. Okay.
It shakes.
How do you feel?
Still a bit shaky.
Right. What we'll do, we'll just try and stand you. If you can't get up, the seat's right behind you again, all right? Do you want to try?
Yes, okay.
Should we go after 3?
Yeah.
1, 2, 3. Push, push. Fabulous.
That's it.
Right. Okay. We've got you. You're not going anywhere.
Anywhere, that's it.
That's it. We've got Malcolm up off the floor with the manga elk. He has lifted quite well, however, he is still very shaky. He's complaining of pain, not in his hip, but more in his lumbar region. Just let yourself go. Right, because of his age, and we are going to take him up the A&E, mainly just for the daughter's sake as well, because she's really concerned about him, says how pale he looks, and I mean, she knows her dad better than anybody. So he's just sitting there now, he's settling down, but I'm happy at him going into hospital as well.
Luckily I've got my phone with me.
Yeah. Be even better if you'd have had your pendant on you, wouldn't it?
Yes.
Hey.
Yeah.
Consider yourself told off.
Yeah.
A lot of elderly people have an alarm in the house, and they also have either a bracelet to wear with a big red button to press or one that's round the neck. The amount of times we go to elderly people on the floor who have got these alarms and they're hanging up on a picture or they're on the bedside table.
Yeah,
as far as you can, just lean back into the chair, put your arms on your lap, and we're going to...
Luckily he brought his mobile phone out with him. I had a phone call when I was driving home to say he'd fallen in the garden. So I came here and he was out and shaking, very cold, and said his hip was hurting. Couldn't get him up, so we phoned the ambulance.
Right. OK.
Thank you.
You're welcome.
So he knows he's supposed to wear his fob, but he doesn't like wearing it. But if he hadn't got his phone out here, he would have been out here all by himself all night.
Malcolm now wears his pendant all of the time.
Yes, I'll make sure I wear it now, because, well, I suppose they're lifesavers, aren't they? You know, I mean, I could... the week before my daughter was in Portugal, so what would I have done, you know? So, no, they're lifesavers without a doubt. I love gardening, so try to do as much as I can. I mean, people used to say, they say I was odd because I used to garden in the dark. It worries my daughter, what I do, but she knows it, you know, it's what I enjoy. My son's the same, you know, he worries about me. I'm a bit stubborn. I'll do it my way, they call me Frank Sinatra.